Sponsored by Regeneron and Sanofi.
When I first heard about DUPIXENT, I was curious about what type of drug it would be and how it could help my skin. My doctor did explain to me that DUPIXENT was a little different than other treatments, and he encouraged me to do my own research and to be more involved with the decision-making process.
I wanted to be involved in the decision-making process because it's my body and it's my disease. I really was interested in doing research about the medication. I wanted to know how it was going to work with my body and my immune system.
It was really important for me to find out everything I could about DUPIXENT. When I started doing my research and talking to doctors, my first thought was, is it going to work for me?
When people have tried a number of different topical therapies and they're just not doing well, that's really where DUPIXENT falls. It's for those patients who've really tried in earnest but are still suffering. And that's really the group that I'm focused on.
I had tried, I think, just about everything out there. I had done all the topical things, I had done phototherapy, and I was not getting results. So when I started talking to my healthcare team about DUPIXENT, I was hopeful. This was something that I thought could really work for me.
My doctor introduced DUPIXENT to me by telling me that he had other patients taking it and they had improvement in their conditions. I had a little reluctance to taking it, but he was confident that it could help me.
When I introduced DUPIXENT as a treatment for patients, I first explained that it is not an immunosuppressant because I think many patients are afraid that a systemic medicine would suppress the entire immune system. I really emphasize that this is a treatment that's going to cool down the inflammation both in the skin and in the rest of the body to help get them some relief.
I learned that DUPIXENT was not a topical or oral medication. This drug works with my body to help reduce underlying inflammation and potentially clear my skin. That was probably the most exciting thing that I found out about DUPIXENT because I always knew that I needed something that was going to work from the inside out.
I did have a lot of questions for my dermatologist. I asked her, have you used this medication? How well has it worked? What kind of results have you seen?
A question I often get about DUPIXENT is how much could it help me? And that's somewhat difficult to answer because of course each patient is different. I usually tell them very frankly that I have seen a good amount of success in patients just like them, moderate to severe atopic dermatitis that's uncontrolled. I tell them that DUPIXENT is unfortunately not a cure. They're still going to have to be careful. It's not going to solve all of their problems, but it's an important tool in our toolbox that may get them better.
My doctor told me that other patients had seen success. He specifically told me that I could experience the same, but he did say it varies from patient to patient.
My dermatologist discussed with me that it may take several weeks or potentially months to see improvement in my skin. A few weeks may seem like a long time to some people, but when you've lived with a condition for years, a few weeks is fast.
DUPIXENT is a systemic medication, and so it's important to share the safety information with the patient.
Before I started DUPIXENT, I told my doctor about all the medical conditions I had and medications I was taking.
Make sure you talk to your doctor about the potential benefits and risks of treatment, including the most common side effects, such as injection site reactions, and some serious side effects, such as allergic reactions, including skin reactions that can sometimes be severe, eye problems, psoriasis, and joint aches and pain.
I also introduced the idea that it's an injectable medication, which may be different than things they've tried in the past.
When I first heard that I had to inject it, I had some hesitations. For some reason, I just felt like this was a little bit out of my comfort zone.
I've never really been a big fan of needles myself.
I went, no way.
There are a number of things that we do to help people get over the fear or concerns with self-injection. The first thing is that for the loading dose, that initial dose that we have to give before you begin your treatment, we actually encourage the patients to come into the office, and usually I'll do the first shot. I'll demonstrate it for them and I'll show them what I do. And then there's a second syringe for the loading. I'll let them do that to themselves under my guidance. Another thing is to enroll them in the DUPIXENT My Way program, where a nurse can actually help them with some of those issues around the self-injection process.
My doctor wanted me to feel good about taking it, so he suggested that I could come to him for the first few injections until I was comfortable actually doing it myself, and that definitely put me at ease.
When I started talking to the healthcare team about doing the injection, they shared with me that my husband could be trained on it too and that he could give me the injection. That really helped calm me because I thought in the beginning that might be a good thing to try and if I couldn't do it.
My dermatologist explained the process. She explained that it would be something that I should be able to become comfortable with. People with atopic dermatitis, we have to overcome things almost daily. So for me, it was just another challenge that I would have to overcome.
After a lot of research and careful consideration and realizing how important it is for my condition, my doctor and I decided to move forward with taking DUPIXENT.
Finally, with my primary doctor and my dermatologist, I made the decision to pursue treatment with DUPIXENT.
I explored everything, talked to my doctors a lot about it, and asked every question I could, and decided that it was the right thing for me.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT. Are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. Are breastfeeding or plan to breastfeed. It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have AD and asthma and use an asthma medicine. Do not change or stop your other medicines, including corticosteroid medicine or other asthma medicine, without talking to your healthcare provider. This may cause other symptoms that were controlled by those medicines to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions, including skin reactions, that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, skin rash, including rash that looks like a bullseye, or painful red or blue bumps under the skin, general ill feeling, itching, swollen lymph nodes, nausea or vomiting, joint pain, or cramps in your stomach area. Eye problems. Tell your healthcare provider right away if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. Your healthcare provider may send you to an ophthalmologist for an eye exam if needed. Psoriasis. This can happen in people with atopic dermatitis who receive DUPIXENT. Tell your healthcare provider about any new skin symptoms. Your healthcare provider may send you to a dermatologist for an examination if needed. Joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with eczema include injection site reactions, eye problems, including eye and eyelid inflammation, redness, swelling, itching, eye infection, dry eye, and blurred vision, cold sores in your mouth or on your lips, and high count of a certain white blood cell, eosinophilia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. In children 6 months to less than 12 years of age, DUPIXENT should be given by a caregiver. Please see accompanying full prescribing information, including patient information.